Every practice will have a slightly different response to improving healthcare for vulnerable migrants. There are some things that all practices can consider to make healthcare more accessible, and there are some specific clinical options that may also be considered. Actions can be undertaken by both admin and clinical staff, and this third and final presentation gives some suggestions. Doctors of the World have created a toolkit to enable practices to become more open and welcoming to vulnerable migrants by removing barriers to registration, providing translation services, maintaining a safe space ethos, and empowering frontline staff with training. All practices may wish to adopt either some or all of the policies associated with being a safe surgery, and Doctors of the World offer training to practices to support this. They also produce a wealth of resources for use in primary care, including new patient questionnaires and an inclusion health self-assessment tool for PCNs and health inequalities leads on their website. GP trainees may consider utilising their QI project resources to help equip their practices to become safe surgeries. And there are also resources for social prescribers and translated health information for patients. At the start of every patient journey is registration. Even if surgeries do not choose to become a safe surgery, it is important for all staff to understand that all people living in England are entitled to register for and access primary care. It must also be understood that proof of identity and proof of address are not requirements to be registered, as much as it may be helpful. Staff in reception may find patients present them with these yellow cards to explain this. Translation services such as Language Line are often used in clinical settings, but some patients may benefit from translation at the front desk or over the phone when speaking to administrative staff. A simple language identification chart may be shown to patients, and online tools such as Google Translate can be used for brief interactions. Practices seeing high volumes of patients who do not speak English may find it beneficial to train administrative staff in using translation services over the telephone to aid with booking and directing patients to the right service. Some digital triage services allow translation via the user's web browser, which may allow greater expression of patient need, so long as they are able to access online services. Providing patients with information leaflets in their own language, such as this one from Doctors of the World, about how the NHS works, can help people who are new to the country to navigate the system and to increase the number of people accessing the right care in the right place at the right time. This may also reduce DNAs. Practices taking on care of asylum seekers based in hotels or specific linked accommodation will in general know the population they are serving and therefore have better opportunity to target health promotion activities, vaccination catch-ups and screening efforts. For the majority of practices caring for patients in alternative accommodation, it will be less clear who may be a vulnerable migrant or who may benefit from additional support. Not all people will include their immigration status on their registration forms, but members of the admin team may recognise a patient's country of origin, patients with no previous UK address, or a recent arrival date into the UK. Vulnerable migrants may have travelled from anywhere in the world, but currently the highest number in this area are from Iran, Iraq, Afghanistan, Sudan, Eritrea, Syria, Albania, Ethiopia, Kuwait, and Turkey. For practices seeing high numbers of vulnerable migrants, there may be a specific role for somebody to identify patients, provide accessible health literature, and book them an initial clinical appointment with a health professional. Where patients have registered without formal ID, spellings of names can differ, leading to duplicate NHS records and therefore complicating continuity of care. A basic passport template is available in the resource pack and could be given to patients to keep, detailing their name, NHS number, and preferred language. It may be possible for some clinical settings to provide a health checkup appointment with a GP or other health professional. and an Ardens template is available in System 1 to support this. Appointments may need to be longer to adjust for translation, but the purpose of the appointment would be to identify any routine or urgent health needs, any untreated chronic conditions, eligibility or need for TB and bloodborne virus screening, and possible mental health or safeguarding concerns. Of high importance is reviewing vaccination status and ensuring that a follow-up assessment with a practice nurse is booked where history is incomplete or unknown. Details of vaccination schedules and catch-ups are available in the online resource pack. For more information and specific details relating to the care of vulnerable migrants, please see the BSW Training Hub website.